Guys, welcome back to Medical Coding with Blue. Today's episode is all about new medical coders, how to handle constructive feedback. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys, so let's talk about what they do not teach us in medical coding school, or if you're learning on your own. They don't teach us how to get constructive feedback, or some people may say critical feedback, but they don't teach us how to take that, okay? And so as somebody who's been in the industry for 17 years, I can tell you, I've gotten feedback from people who were really very good with their work, with their job. They showed me how to correct the mistake that I had made. Everybody's going to make mistakes. Everybody does, okay? We have to know what doctors know while never having gone to medical school. So that's something that you have to understand right away. If you make a mistake, that is a natural part of this career field. The key is to not continue to repeat that mistake. That's one of the keys. The second one is that when you're given feedback and you're told, hey, you did this wrong, you need to make sure that they're giving you a reference, a resource, something official, not just, hey, we do it this way, and then nothing to follow it up. Because we are health information professionals. We follow a code of ethics, and we have to code accurately. If you have something that shows that you coded something accurately, make sure that you are supplying that so that you have a firm argument or something to help you with your response of why did you do it this way, okay? So that's something that we need to know right out of the gate, okay? Is that we can use these constructive feedbacks as a learning tool, okay? And sometimes the way that it is presented, though, I know the way that it is presented sometimes is not always the greatest, but you have to remember this as well. Not everybody is as professionally evolved. Okay, there are some people that never do any sort of self-improvement, in which I think if you want to be a great and awesome professional coder, you need to do self-improvement, because you need to be able to take feedback and you need to be able to give feedback and do it in a way that is going to be open and receptive to other people, that they'll be willing to take it. But sometimes it doesn't always happen. You could be the nicest person and people may just not like you. That's the nature of the beast, right? Is that people just may not like you for whatever reason. But it doesn't necessarily mean that their correction of you is wrong, okay? So that's something that we need to make sure that we're putting ourselves aside. In this industry, you have to put yourself aside a lot. You have to put aside your own feelings. You have to put aside your own, the way that you look at things. So your own personal bias, you need to kind of put that aside as well. And you need to look at the situation with a more analytical eye, right? If somebody is correcting you, and let's just say they're putting it in a way that is very rude and sort of nasty, but what they pointed out was actually correct. You need to think to yourself, hey, this has nothing to do with me. Their attitude towards me has nothing to do with me at all. It is whatever is going on with them personally. And it's not on you to say, oh, are you having a bad day? Oh, okay, I understand. No, you don't need to say that, because that'll incite somebody too, okay? But you need to leave them alone, but just take the feedback and, okay, you learn from it. You can research whatever they're giving you, and so that way you can make sure that you're not doing it again. But what we need to learn to do is filter out those unnecessary words that they may say, like, oh, you should already know how to do this, or you should have done this, or you should have done that, or why don't you know this? That's not really very professional, right? And so if we start allowing ourselves to listen to somebody who's giving us all of these other useless words and trying to make us feel bad, then we're letting that person win. And I know that this is very difficult to hear, okay? Because I've been in this for 17 years, and I have been through the gamut. I have had people who were very not nice, and they've given me feedback. And when I looked at my answer versus their answer was wrong and mine was right. Then in my head, I know that this is a person that knows that I was right, especially if I'm showing that I have something. And that's the deal, is that as long as you always have something official to defend yourself, you can never go wrong. And if somebody is still saying, oh no, you're wrong, you're wrong, you're wrong, there is a hierarchy to these things. It's not just that it stops at the auditor. There's somebody above that auditor, and there's somebody that's usually the tiebreaker, okay? And so that's when you have to insist that, okay, if it's not working out between you two, you got to make sure that you rein your emotions in and that you try to be as calm as possible. Again, I know that that's very difficult because it's very easy to get all worked up. But at the same time, nothing is going to get resolved if you start getting loud and getting upset as well. So it's a struggle. I understand, because I still go through that. Sometimes I get very excited and we can have spirited discussions, especially when I know that I'm right about something or whatever the case may be. So that's just one thing that you have to work at it. It is a muscle that you have to work at. But we need to think about, again, regulating ourselves and how we are responding to these situations, because sometimes the first thing that we want to do is cry, right? At least I know for me, sometimes when I can't find my words and I get really upset, I have been known to cry. Of course, I'm not going to cry there in the situation, but I will cry later on, because sometimes that's all you can do. It is a natural human reaction. Now that I have come up in the industry, though, now that I have done a lot of work on myself, you have to work on yourself a lot in order to be able to control that. But a lot of times for me, when I would get really upset and I'd cry, or somebody would hurt my feelings because they said something to me about like, oh, this was wrong, and this was, how did you not know that? You know, I started to look at, how important is this person to me? And were they right? If they were right, okay, so they were right and they pointed something out, but I didn't like their attitude about it. So, but that's me personally not liking their attitude. Some people like to tell people that they're wrong. And unfortunately, that does happen. But then I had to start thinking, okay, I didn't like the way they said it, but maybe something is wrong on their side. It has nothing to do with me. And once I started taking that off of me, that it had nothing to do with me, that something else was going on with them, it doesn't excuse the behavior, but it does rationalize in my mind, okay, I don't have to listen to this. They gave me the error, the correction that I needed or whatever, because something was wrong or whatever, I need to correct it. And that's it. I learned that. I learned whatever it was, okay? But there is a line, though, obviously. You don't want to continuously take bad treatment because, you know, somebody wants to be on a high horse. There are people like that. There are people that will be on a high horse. High horse meaning that they want to be superior, they want to act superior because they're in a certain position. Their title is what they feel gives them the right to treat people whatever way they want to. Okay, I had an auditor a couple years ago now that found found an error. It wasn't. It was clear that this person doesn't understand anatomy. Okay, whereas I do. When it comes to the bones and bone work, whew, you got to be real sharp on that. And that's the one thing that I do know. You can't get me on that one. Okay, but this person that was auditing me was insisting that she was right, and I gave everything. I showed all of my references, everything that was official, all of these things. And her final word on the matter was, oh, auditor stands by her word. Do you think that matters to me? No, absolutely not. So I requested for the matter to be escalated to the next level, right? Which, of course, it came back to me because I was correct. But the thing about it is, sometimes when people have nowhere to go in that kind of situation, well, auditor stands by her word. Just because you're an auditor doesn't mean that you're superior. Just because you have different credentials than me doesn't also make you superior either. At the end of the day, it comes down to the books. It comes down to your knowledge base. I have gone toe to toe with people who have degrees. I have gone toe to toe with nurses. Again, RHIAs, RHITs, I've gone toe to toe with everybody. I've gone toe to toe with people who've had years of experience and still come out on top because of my knowledge base. Okay? So there are things that do happen in your career where you're going to turn up the volume on that learning, and there's nobody that can beat you when you know a lot about coding. And there will be people that will try to beat you. The more you're in this industry, the more your reputation will grow. If you have a reputation for being right a lot of the time, right, you're always going to try to find somebody. There's always going to be somebody that's going to try to find something wrong with what you have. Okay? There will always be people like that. There is literally nothing that you can do when you run into situations this way. The only thing that you can do is you can continue to be yourself. You can continue to do things correctly and code correctly. And when you receive a correction, that you are gracious and that you accept the error and that you make the correction and you move on. You never say, well, I don't want to take this error because it's just because this person did it. And even though they were right, I'm still going to disagree because I'm not going to take their error. And I'm just going to be difficult about it. Then you are in the wrong. And you're actually in the wrong industry if you do that. Okay? Because at the end of the day, it is not about us. Nothing that we do is about us personally. It is about the patient overall, everything. It is about the patient, because if we are not coding correctly, that is a problem. If we are not coding correctly, that is a problem. We have to do everything that we can in our power to make ourselves as intelligent about these coding rules as possible, about the coding, the sequencing, and everything. We need to stay on top of our game for them. So if it takes making one or two errors and then, you got to get a correction or whatever, and somebody gets blustery about it, let them get blustery. Because again, that has nothing to do with you. Their blustering has nothing to do with you personally. You may feel that way, but no one can make you feel any way that you do not personally allow them to. Did you hear me? No one can make you feel anything unless you allow it. Now, I know there's some people that have a way of making you feel infuriated. I get that. But if you allow them to have that, they can sleep at night. You're the one who's upset. And I know that is so hard, because again, trust me, I've been there, done that. There's been people that have really upset me. And then when I think about it, I think, why am I getting upset about this person? Is this person, I started questioning myself, is this person somebody that I want to be like? Absolutely not. Is this person somebody that I admire and that I could put myself in their shoes and see that I did something wrong? No, absolutely not. Absolutely not. I would never want to be like this person because of whatever reason, for whatever way that they're treating me. Again, it has nothing to do with me. It has everything to do with them, themselves, whatever's going on with them. I've been in situations before where I wasn't treated nicely right out of the gate. And there was a lot of attitude and a lot of just mean girl energy, right? I didn't do anything. And the reason was a personal reason for that person. But when it came out later why she was giving me such nasty attitude, it made everything that she was doing made a lot of sense, even though at the time I was brand new, not evolved, and I thought everything was about me. But I was also going through my own personal struggle, which was the loss of my mom. So going through all of that at that time, again, I'm thinking, oh my gosh, there's all these things. So again, when you're brand new and you're not given these tools on how to handle this, what do, right? And so that's why I'm telling you guys now that I think about this person that did all of these mean girl things to me in the past, right? I think about how sad I feel for that person. But at the time, not really knowing that, or not really understanding that had nothing to do, her attitude had nothing to do with me personally, but that it had everything to do with her. And later on, she had sent several invitations to get together and have dinner, and I refused, not out of pettiness or not out of like I don't care, but it was that this isn't a person that is somebody that I would want to be around anyway. And so a lot of times now when I get that negative feedback from anybody, I think that to myself, is this somebody that I care what they think about me? No. Is this somebody that I would want to be around, or do I want to be like them? No. And so that's kind of what helped me kind of like, okay, reframe my thinking and think about other things. Because my only goal now is to make sure that all of my patients that I'm coding for, that they have excellent coding, and excellent documentation, so they can take to their next doctor, whoever they see, or if they have to see a specialist, they have good documentation to start with. Okay, that's what's important to me. And once you give yourself permission to think like that, it is freedom. It really is, because then you stop caring about what other people think. And I think this comes also with just time, that after a while, that even though somebody may give you an attitude, or they may say, oh, you have this credential. I have another viewer who's going through it too, and who has a CCA. And to me, CCA is a fantastic credential. She got hired with the CCA, not once, but twice, right? She got promoted. She went from revenue cycle and she went over to the coding. But somebody in her department is giving her a hard time, asking her if the A can be removed from the CCA, because she has a CPC, and she's thinking that the A is like an apprentice, and it is not. And so the lady explained it to her that no, it's an associate, and that's different for a HEMA. Well, that lady only knows outpatient coding. And by the explanation that the other lady gave her with the CCA, she's explaining to her, hey, I have inpatient coding and outpatient coding. So again, that makes some people, when you know more than them, it makes them uncomfortable, and there's all sorts of feelings that they have. But as I told the lady with the CCA, do you want to be like this person? She said no. Okay, well, then there's your answer. What she says should not matter. You got that position, you were promoted into that position. That means not only do you have the competency to be in that position, you are more than qualified to be in that position. Not only that, having a CCA allows you to be not just inpatient coding, but outpatient coding as well, which somebody who has a CPC only knows outpatient, because that's what they do. That's what their credential says. Now, they may know ICD-10 PCS, they may not have been tested on it, but there's a difference there when you have a credential that says what you know versus somebody that just has one credential and they don't really know, right? Or they know they're only one thing, which is outpatient. So that's the thing, guys. Don't take criticism from people that you don't want to be like, okay? As far as like if they're trying to say something snarky to put you down, okay? If they're insulting your credential, if it's somebody that says, oh, well, you have, I got that too when I got here. I had a lot of people around me who all had CPCs, and they were like, well, Blue, why don't you want to be like us? Why do you think that you're better? I don't think that I'm better. I just have a CCA. Why do I need to change? Why do I need to spend more money to get another credential when I have a credential that says I know inpatient coding and outpatient coding? Is it your money that's going to be spent? No, it's mine. And as somebody who is financially responsible for myself only, and who I don't have backup, I don't have a husband, no boyfriend to help me. You know what I mean? Uncle Kyle will help me, sure. But that's besides the point. It is about okay, being responsible, number one. Number two, and knowing what I have. I have a credential that at the time, again, says I know inpatient coding and outpatient coding. I have the Mastery Medical Coding Certification now, the CCS, and I also have the CCSP. Okay? So, but at the time, again, still I could go anywhere. I was not just chained only to an outpatient position. I could certainly work inpatient. So that's the difference. And once you know that, and once you start to become more confident in yourself and your abilities, trust me, it gets a lot easier to start ignoring the nonsense. Okay? When you start to be able to filter out that nonsense, because that's exactly what that is. And some of it is going to come off as, oh, real snarky attitude. And you know, a lot of times it's just jealousy. Sometimes it is. And sometimes, again, it all depends on what's going on with that person. They may be going through something personally. But that's not for you to say, oh, are you going through something personal? Oh, no, because that's fake. It's fake. You don't ever want to do that. Don't ever behave that way. You may be thinking it, but don't ever behave that way. Because there's something to being gracious and being like, okay, I got whatever you said, that's fine. I'll just fix it or whatever. And learn from it and move on. And do a deep dive. Make sure that what you're doing is correct. Don't just take everybody at their word, all right? Because the one thing that no one can ever take from you, the one thing that no one can ever bypass you on is your knowledge. And in this industry, that is more important than anything. That is such an important currency to have that knowledge and to be able to say these things and to understand what it means. It's not just about reciting guidelines. It is about understanding those guidelines. I knew somebody that everybody was so impressed with her because she memorized the guidelines. But did you know that when push came to shove, she couldn't put the guidelines together in action? Like somebody could ask her what a certain guideline was and she'd spout it off and everybody was all so impressed. But when it came down to it, there was things that she would be missing. Like, with mother baby and with, those extended weeks codes, you know what I'm saying? When they're like 42 weeks. And so she would miss that. She didn't think that was a problem. And when it's documented, it's there, and it's not up to her to be like, oh, well, just because I know all these things, you don't have to pick that up. No, according to the guidelines, yeah, you do pick it up. You do look at what's there. You do look at the documentation, and we do need to make sure that we translate everything that's going on here, because this is about statistics. It is about being detailed, and it is about doing all of those things. And so again, when I started to see her for who she was and the limits of her knowledge, okay, I was able to understand that sometimes when you have more knowledge than other people, they will feel like, oh my gosh, this person. But you don't have to worry about all that. You do not have to worry about all that. You just keep focusing on improving yourself and improving the way that you respond to these people. But I will say this in closing, that if it is so bad though, that it's just breaking you down, and that it's just relentless, and that you just don't feel comfortable, you have experience, right? It is okay to move on. Don't give yourself some arbitrary deadline of, oh, I want to stay a year. Do you know I moved twice? I had 3 positions total. I started off at the Cancer Therapy Research Center. I went to my second job when I moved. And then I came here to my forever home. So I had 3 different positions in the course of 1 year at 3 different places in 1 year. So please don't tell me you can't get another job because you want to stick it out for a year. I'm sure there are other places that you can go, because once you have 3 months experience or 6 months of experience, you can be still applying. You do not have to take somebody's constant attitude. If they're going to be mean to you all the time, if it's not getting better, you don't need to stay there. You can move on. You can find another place that's going to treat you better, because not everybody will have the same philosophy. There are some places where the philosophy is going to be completely different. And sometimes there will be places that will treat you with so much more. They will celebrate your wins. They will do those things with you versus wherever you are. And maybe it's a negative environment, okay? But you can find those positive environments. I know, because when I have worked at places, right, I have seen the night and day difference. I have seen night and day difference. I have been personally treated so well at some of these places when I've worked there that it's just like, wow, this is what happens, you know. But that's the thing, you know, you need to find that for yourself as well. Do not feel trapped. If you feel trapped, if you feel so unhappy, it is okay to move on. It is okay to take the experience that you have, be it limited, maybe it's 3 months, maybe it's 6 months. You can take that, write everything down that you've been learning, the electronic health record that you've been learning, the specialties that you've been learning, the different settings, if you've been doing like same-day surgeries or if you've been doing inpatient professional services. Write that down, get it onto your resume, and start applying again. You got that position, you could certainly get another one, because nobody should take bad treatment. Nobody, okay? But again, we also need to make sure that we've got a thick skin. We need to make sure that we are being tough too, because again, these people they're going to say things and maybe they're just having a bad day. Maybe it's a temporary thing. But if it is ongoing and you just absolutely cannot take it, then you need to make sure that you are getting a game plan together and that you are finding a job before you leave that job. Do not leave that job before you have another one lined up. Do not leave a bad job before you have another one lined up, okay? Because that's just foolery, all right? If you leave just to be leaving on a whim, don't do that, okay? But have something else lined up, because yes, you can. You can absolutely do that. This is my advice anyway. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.